Welcome, everyone, to another episode of Off the Charts. I'm Mike Dake, and I'm here today with Roberta Brinton. Robbie is the director of the highly successful, impactful Center for Innovation in Brain Sciences. And we're here in her labs, and we're going to sit down and have a conversation about what's exciting with SIBS now, what your career, how you got to this. I mean, her organization is incredible in terms of its scope, and she's been highly successful, so we're going to learn a lot. Bing, bang, one shot. Oh. Bing. So, Robbie, I think a lot of our viewers would really like to understand your career. I mean, it's been so successful, but how did you get started?
I started here at the University of Arizona. It's kind of my scientific origin story. Here in the pediatrics clinic, where I was a lab tech and teaching interns and residents and medical students how to interpret laboratory data and how to do some simple laboratory tests that they would continue to do in their own clinics. And what was transformative for me was how the physicians and the nurses and the interns and residents, the clinic director, included me in this team, and that there was a real appreciation for the intelligence that you brought, not necessarily the degree that you brought. And that was a transformative experience for me. It actually taught me I was smart. And I have advanced that whole strategy throughout my scientific career to build those teams that bring in different types of intelligence to address really challenging issues and really challenging problems. And so I started going to college here at the University of Arizona at night, and which was wonderful, and had wonderful professors. And then realized I'd be probably in my 70s by the time I finished college, going at night. So I had $5,000 in retirement, and I bid my colleagues and mentors farewell for the moment, and went to college full time, finished up in 2 years, and then went to graduate school here, and earned my PhD. And then went on to Rockefeller as a postdoctoral fellow. I was in the laboratory of Hank Yamamura in pharmacology. And that's really where I developed my interest in therapeutic development. Went to do my postdoc and then at Rockefeller, and was recruited to USC. And then had the astounding opportunity to return to the University of Arizona to lead the Center for Innovation in Brain Science. And I was very fortunate. I sat down and I asked, what is bold? What is the opportunity that the University of Arizona presents to me again? And in that moment and in that deliberation, I developed the vision for the Center for Innovation in Brain Science with the mission to bring innovations in brain science of the future to those who need a cure today. And we're focused on Alzheimer's, Parkinson's, multiple sclerosis, and ALS, 4 neurodegenerative diseases of aging. And so far, we have been remarkably successful.
You certainly have. And I mean, you're very busy. And as you said, each one of these 4 neurodegenerative foci take a tremendous amount of time. One of the challenges of a busy leader, of course, is to find a work-life balance. Have you been able to deal with that, or how have you been able to deal with that?
Well, gratefully, I am passionate about the opportunity and the work that we do and the science that we do. And I keep thinking, Van Gogh never stopped thinking about art. And never stopped thinking about looking at nature and being, passionate about that. And that's certainly been my life. I welcome the opportunities where I'm able to take long walks, because those long walks are those opportunities where many different points of information and insights can emerge and bring, kind of these critical insights of why is it that the brain is vulnerable to developing these neurodegenerative conditions with age. So what we're working on right now is is there a unifying mechanism that is flipping the brain to vulnerable, right? And we're about to put in a very large proposal to really examine the hypothesis that it's a bioenergetic crisis of the brain, right? That it's the energy producing system of the brain and is faltering. And that emerges differently for diseases, but it also emerges differently based on sex.
Yes. Yes, I know Robbie's done a lot of work on gender differences in these neurodegenerative things.
Yeah.
And the SIBS has been a leader in sort of bringing that to the forefront of people in the field.
So we're, we're exploring that avenue of the bioenergetic crisis. And the other component to, I think, the innovations that we're bringing in the field is actually regenerating the Alzheimer's and Parkinson's brain. And we're quite fortunate. I have to give a shout out to the CAT Clinic, where we're doing our open label trial of a regenerative therapeutic in Parkinson's, persons with Parkinson's condition. We've been surprisingly successful, better outcomes than I could have ever imagined. So we're very excited about that. And our Alzheimer's trial is continuing. It's a phase 2 double-blind placebo-controlled trial, multiple sites around the nation. And part of what I think is so important is that it's possible here at the University of Arizona. I like to say that the University of Arizona has the critical mass without the burden of mass, right? And so you have this deep domain, this deep bench of expertise across multiple domains, which is increasingly important that we actually have access to experts in multiple fields, right? And that's possible at the University of Arizona. We can have those conversations with colleagues and leaders. That just doesn't happen at other institutions where everything is so siloed. We have been very fortunate to collaborate with colleagues in the Brain Imaging Center here, where Nanquay Chen, for example, has developed this amazing strategy, MRI-based strategy, where we can actually image this very small area of the brain, the substantia nigra, that's affected in Parkinson's, and actually measure whether it's regenerating, over the course of treatment. And that's downstairs.
Yeah. One of the great things about SIBS, a shout out, and so everyone knows, it's one of the few centers in the university vertically integrated. I mean, from the basic science, the basic discovery, innovation, diagnosis, and now therapy, it's all here.
Yeah.
And that's what's so wonderful. So let me ask you another question. So in a life outside medicine, what would you have liked to have done?
Oh, what would I have liked to have done?
Open a restaurant, whatever you can choose.
That's interesting. Once I was introduced to science, I was a lab tech, right? And actually, you know what? I thought about going for an MD, and I realized that honestly, I was interested in the brain, right? Grateful for all those organs, every single one, and how they work. And I was captivated.
You had a love for the brain,
yes.
And the rest, the liver was not in your...
Well, I love my liver. It's interesting because when I started, both my undergraduate and graduate work, neuroscience didn't exist as a discipline.
Yeah.
It didn't exist. And what was so exciting about here, it was just being built here.
Yeah.
And as a graduate student, I had that opportunity.
That's very exciting to be in that
Yeah.
in that high ramp up phase.
Yeah,
that you
yeah.
really feel is just a unique opportunity. So let me ask you, what's a piece of advice that you've been given over this career that has maybe stayed with you and guided you in your career?
The greatest advice has really been through my mentors, who modeled for me this commitment to this discovery process.
Yes.
And that was bring everything you are to the table.
Yeah.
There is this joy of this discovery process. And then there's the joy of actually bringing that discovery to those that you have been imagining and working so hard to, address this challenge of why the brain is developing these diseases. And then how can we learn from that?
Well, certainly SIBS and you have contributed greatly, not only to the science and our understanding, but now even to the lives of patients. And those changes in practice are what make a difference in a career.
Yeah.
And we're so proud of you and appreciative
Thank
of what
you.
you've done here at the university.
Thank you.
Thanks so much for being with us today.
Thank you.